You can have histrionics about how millionaires and billionaires are ripping off the American people, but there's a process here, and the Congress works better as a process.
Mr. Chairman, did I get these amendments in on time according to the process?
Absolutely. And are they paid for? Are they paid for, Senator Sanders?
They will be paid for.
They will be paid for. Well, let's work on it.
Yeah,
in the future, let's work on it. Let's work on it. We actually are going to have a hearing in July in which we can pay for it, and I told you that, and that's when we're going to do this. And that's the way the Congress is supposed to work, and that is fair to the American people, not moonbeams and flatus somehow finding a way to pay for things.
Chairman, the Congress does not work.
Well, clearly it's not working with that, but it can work, and that's my mission.
Congress is broken, health care is failing, and Americans are paying the price. In a fiery Senate clash, Senator Bernie Sanders blasted Congress for ignoring a growing doctor and nurse shortage while millions struggle to afford care. But the committee chairman fired right back, accusing Sanders of pushing unfunded, poison pill amendments and bypassing the legislative process. What followed was a tense exchange over health care, spending, and whether Congress is actually capable of solving America's biggest problems. Let's get into it.
Thank you, Mr. Chairman. I would say that I agree with one point that you made. The American people certainly are frustrated with Congress. I think we are somewhere ahead of Iran right now in terms of favorability, but not by much. And why is that? The reason for that is that all over this country, people are hurting. And I don't know about my Republican colleagues, so I think the answer will be the same, but I do talk to a lot of Democratic candidates. And they tell me that we're out there on the campaign trail, and they hold town meetings. The issue that comes up probably more often than anything else is the understanding that our healthcare system today is broken, it is dysfunctional, and it is wildly expensive. And the American people are saying, does anybody in Congress know that? Do they know that I can't afford to send my kid to a doctor? I can't afford prescription drugs for my parents. So today, the so-called, let me say a word about the so-called poison pills that I will be offering to address some of the crises that we face. And I want the American people to decide whether or not they think these are poison pills, outrageously bipartisan efforts trying to sabotage the work of the chairman. For a start, as bad as our overall healthcare system is, and by the way, as everybody on this committee knows, we spend twice as much per capita on healthcare as the people of any other nation, over $15,000, and yet 85 million Americans are uninsured, underinsured. Some 60,000 people a year die because they can't afford to go to a doctor. Maybe we want to be addressing that issue. Now, as bad as the overall healthcare system is, the primary healthcare system is in even worse shape. In America today, tens of millions of people live in communities where they cannot find a doctor, a dentist, or a psychologist, even when they have decent insurance. I know that's true in Vermont. I suspect that is true in every state in this country. And if we do not get our act together, given the enormous shortage of doctors, dentists, and psychologists we have right now, the situation will only get worse in the future. We are facing a shortage of 400,000 nurses over the next 2 years alone. So, Mr. Chairman, you think this is a poison pill that we talk about? The need to make sure that we have nurses and doctors all over this country? It doesn't seem to me to be a poison pill. It seems to me to be something we should have addressed years ago and we should address now. Over the next 12 years, we face a shortage of 180,000 doctors and 400,000 mental health practitioners, while over 60 million Americans live in districts where they can't find a dentist. Every major medical organization agrees that our investment in primary health care is woefully inadequate, and I suspect that every member of this committee understands that as well. There is a reason why most other major countries spend over twice as much as we do on primary health care and end up with far lower capital costs than we do. They invest in keeping people healthy, keeping them out of emergency rooms, out of the hospital, and that makes sense to me. The backbone of our current primary health care system, as weak as it is the federally qualified community health center program, the FQHC program, an issue that I have worked on for many years. Today, more than 30 million men, women, and children receive high-quality primary health care at community health centers in more than 16,000 neighborhoods located in every state in America. Many of these centers also provide dental care, mental health counseling, and low-cost prescription drugs. Unfortunately, George Washington University projects that community health centers will lose nearly $42 billion in revenue over the next 5 years. So, Mr. Chairman, if you think it's a poison pill that we begin to address that issue right now, I would respectfully disagree. The National Association of Community Health Centers estimates that health centers will see an increase of 4 million uninsured patients in the coming years. And that is why, Mr. Chairman, the First Amendment I will be proposing would increase community health center funding from $4.6 billion this year to $5.8 billion next year. Given the fact that a majority of senators on this committee have already voted in favor of this funding level, I hope it will pass. But that's not the only amendment that I'm going to offer. This amendment would also provide loan forgiveness and scholarships so that we get more doctors and nurses into underserved areas. Mr. David, as this amendment would provide $120 million over a 3-year period so that every state in America has a teaching health center in their state. Teaching health centers, enormously important way to make sure that we have doctors and nurses in rural areas. So, Mr. Chairman, I do not agree with you that these are poison pills. I would say that every amendment that I am offering is widely supported by the American people, Democrats, Republicans, and Independents. I hope you will support them.
A couple things for clarity. You said that you're sabotaging the work of the chairman. Actually, this is the work of our colleagues, bipartisan work of our colleagues. These amendments are not germane, and they were filed Tuesday. Now, there's a process by which there's full consideration of a bill, of an amendment that comes before us, and then we take that processed amendment so that we all understand it. We all have an ability to understand it. If you drop a non-germane amendment, which, by the way, is not paid for, 2 days beforehand, you're going to have histrionics about how millionaires and billionaires are ripping off the American people, but there's a process here, and the Congress works better as a process.
Mr. Chairman, did I get these amendments in on time according to the process?
Absolutely. And are they paid for? Are they paid for, Senator Sanders?
They will be paid for.
They will be paid for. Well, let's work on it.
Yeah,
in the future, let's work on it. Let's work on it. We actually are going to have a hearing in July in which we can pay for it, and I told you that, and that's when we're going to do this. And that's the way the Congress is supposed to work, and that is fair to the American people, not moonbeams and flatists somehow finding a way to pay for things.
Chairman, the Congress does not work.
Well, clearly it's not working with that, but it can work, and that's my mission.
This hearing exposed two very different views of why America's healthcare system is struggling. Senator Bernie Sanders argued that the real crisis isn't politics, it's the growing shortage of doctors, nurses, dentists, and mental health professionals across the country. He warned that millions of Americans already struggle to find care and that the problem is only getting worse. Sanders pushed for increased funding for community health centers, loan forgiveness programs, and incentives to bring more medical professionals into underserved areas. The committee chairman didn't directly reject the need for more health care workers. Instead, he challenged Sanders on the process, arguing that his amendments were not properly vetted, were unrelated to the bill being considered, and lacked a clear funding source. The chairman insisted that Congress must follow a transparent legislative process rather than rushing through expensive proposals at the last minute. The most revealing moment came when Sanders declared, "Congress does not work," while the chairman countered that Congress can work, but only if lawmakers follow the rules and build bipartisan consensus. At its core, this wasn't just a debate about health care. It was a battle over how Congress should operate, how new spending should be funded, and whether Washington is capable of addressing the problems Americans face every day. If you enjoyed this breakdown, make sure to like the video, subscribe to the channel, and turn on notifications for more congressional showdowns, political analysis, and breaking news coverage.